Welcome to Dr. Phil Me In on Cystic Fibrosis, starring Ariel the doctor, Sophie the genetic counselor, and our special guest, Anne the concerned mother.
On tonight's show, we have a very special guest who is pregnant and a carrier of the cystic fibrosis gene. So Anne, how do you cope with knowing that your child might have cystic fibrosis?
I've always known that I'm a carrier for the cystic fibrosis gene. However, I just found out that my husband has one too.
Before you get too scared, let me tell you a little bit about cystic fibrosis. Cystic fibrosis is a genetic disease that affects approximately 1 in every 3,600 Canadians. People with cystic fibrosis suffer from mucus clogged lungs, which eventually leads to difficulty in food digestion. Patients with cystic fibrosis are often known to be very small, although they consume about the same amount of food as typical people.
Also, to reassure your worries, if two parents who are carriers have a child, there is a 25% chance that the child will be born with cystic fibrosis, a 50% chance that the child will be a carrier, and a 25% chance that the child will neither be a carrier nor have cystic fibrosis.
Oh, okay. Is there any difference between boys and girls with cystic fibrosis?
Yeah, so females are actually able to have children, while 98% of males are infertile.
I see. Which genes are affected?
CF is inherited in an autosomal recessive pattern, meaning that both parents have to either be affected or carry the allele in order to pass it down to their children. Cystic fibrosis occurs when one base pair in chromosome 7 is out of place. Mutations in the CFTR gene is located on chromosome 7 can cause cystic fibrosis. However, the most common mutation is the deletion of 3 DNA nucleotides, which leads to a deletion of a very important amino acid.
What is the life expectancy of a patient with cystic fibrosis?
A patient with cystic fibrosis lives approximately 37 years. Affected individuals live normal lives until their disease worsens to the point where they become disabled.
Wow, that's rough. But what happens on a genetic level?
Well, the CFTR gene provides instructions for making a channel that transport negatively charged chloride ions in and out of cells. Chloride ions help control the movement of matter in tissues, which is necessary for the production of thin, freely flowing mucus. Mutations in the CFTR gene disrupts the function of the chloride channel, which prevents them from regulating the flow of chloride ions and water across cell membranes.
As a result, the mucus coats the breathing tubes, which prevents the cilia from cleaning dirt out of the lungs. This leads to serious infections and permanent lung damage. The organs produce mucus that is unusually thick and sticky, which clogs nasal passages, leading to infections and inflammations.
Wait, so how can I actually test to see if my child has cystic fibrosis?
There are a few tests that you could take at different stages of your child's development to test if he has cystic fibrosis. In the newborn screening, you could either do a genetic test, which would show if the newborn has CFTR genes, or a blood test, which would show if the newborn's pancreas is working properly.
You can also take a prenatal test at your time of pregnancy, which would determine if the fetus has cystic fibrosis. In the amniocentesis test, a needle is inserted through the abdomen to extract amniotic fluid. The sample can be taken after the 14th to 16th week of pregnancy. Another option is the CVS, where a suction tube is inserted through the cervix to extract tissue from the chorionic villi, and this test can be done after the 8th to 10th week of pregnancy.
However, the most common test done to diagnose for cystic fibrosis is the sweat test, which measures the amount of salt in the patient's sweat. A high level of salt can confirm this diagnosis of cystic fibrosis.
So if I do have a child with cystic fibrosis, what are some treatment options?
There are many treatment options, however, none of them can actually cure the disease. The main treatment used to prevent and treat lung infection is antibiotics. In severe cases, surgical procedures can be done to provide immediate treatment to the patient. This includes removing the nasal polyp, as they often block airways. Also, in case of critical lung complications, a lung transplant can be performed on the patient.
Wait, so there is no cure?
Correct. To this day, there is no cure. However, treatments have increased the life expectancy of patients tremendously. As a matter of fact, in the 1980s, the life expectancy of someone with cystic fibrosis was only 14 years.
I know that treatments for cystic fibrosis patients can save their lives, but I heard that it costs approximately $19,000 a year for treatment.
Wow, how did you find out about this?
My best friend has a son with cystic fibrosis. She tells me about his everyday struggles. He must eat well every day, but he must also watch out for certain foods. Also, homework and school tasks are not so simple to complete due to respiratory and inhalation therapies. In his spare time, he also contacts people from support groups to help him relieve stress.
Really? Which support group does he attend?
The Cystic Fibrosis Canada group.
Oh.
Well, we hope that your child does not have to be familiar with that lifestyle, and that concludes the Dr. Phil Me In on the Cystic Fibrosis show. Thanks for joining us, and stay tuned for Dr. Phil Me In on obesity next Friday at 7 p.m. Eastern Time.